The glittering ballroom of the Ritz-Carlton sparkled with crystal and wealth, a perfect setting for my sister Victoria's wedding to banking heir James Wellington III. I adjusted my borrowed servant's uniform, playing the role they'd assigned me. "More champagne, miss?" A real server whispered sympathetically, recognizing me despite my disguise. "I'm fine, thank you," I replied softly, watching my family hold court at the main table. They'd made it clear. The daughter who chose medicine over marriage had no place at their society wedding. "The help eats in the kitchen," my mother had announced when I arrived, handing me a server's apron. "Since you insist on playing doctor instead of finding a suitable husband, you can make yourself useful." So here I stood in the shadows of my sister's perfect day, wearing borrowed black and white instead of a bridesmaid's gown. 10 years of medical school, a groundbreaking surgical fellowship, and becoming the youngest chief of surgery at Metropolitan Memorial Hospital meant nothing in this room. "Did you hear?" a guest whispered nearby. "Their other daughter is some kind of doctor." "How unfortunate." My mother's tinkling laugh carried across the room. Victoria made the right choice, focusing on marriage rather than wasting time on a career. A woman's place is in society, not in some dreary hospital. I caught my reflection in a silver tray, still elegant despite the servant's clothes, my surgical precision evident even in how I carried myself. A decade of saving lives had shaped me differently than my sister's years of charity luncheons. "Speech time." Someone called out. The groom James stood unsteadily, champagne glass in hand. He'd been drinking heavily since the ceremony. "To my beautiful bride," he slurred slightly. "And to proper ladies who know their place isn't in an office or hospital." Laughter rippled through the crowd. My sister beamed, basking in their approval. I noticed James's slight sway, the faint blue tinge to his lips. As a surgeon, certain symptoms triggered automatic alerts in my mind. Something wasn't right. "More champagne for the groom," someone called. James raised his glass, then suddenly clutched his chest. The crystal flute shattered on the marble floor as he collapsed. For a moment the room froze in tableau, the society guests in shocked silence, my sister's perfect smile shattering, my mother's hand flying to her throat. "Call an ambulance," someone finally screamed. I was already moving, surgeon's instincts taking over. "Clear space. Let him breathe. Get away from him," my mother shrieked. "You're just the help." I ignored her, checking James's vital signs. Pulse irregular, breathing labored, skin clammy. Classic signs of paramedics are 5 minutes out, the hotel manager announced. "He doesn't have 5 minutes, I muttered, starting chest compressions. "Someone get me the hotel's emergency kit." My sister stood frozen, her white dress gleaming under the chandeliers. "What's happening to him?" "Aortic dissection," I answered automatically. "His heart is." "Stop pretending to be a doctor." My mother grabbed my arm. "Get back to the kitchen where you belong." The paramedics burst in, equipment ready. One look at James and their radios crackled. "Critical cardiac event. Need immediate consultation with Chief of Surgery at Metro Memorial." I stood, removing the borrowed apron. "I'm Dr. Eleanor Mitchell, Chief of Surgery. Patient presents with suspected type A aortic dissection, requiring immediate surgical intervention." The paramedic's eyes widened with recognition. "Dr. Mitchell. We didn't. Why are you?" "Never mind that," I cut them off. "Get him stabilized for transport. I'll call ahead to prep my surgical team." My mother's face had gone pale. My sister stood speechless, her perfect wedding dissolving into a medical emergency. As we rushed James to the ambulance, I heard whispers rippling through the crowd. "That server is the chief of surgery? Did she say Dr. Mitchell? The pioneering cardiothoracic surgeon?" "Eleanor," my sister caught my arm as I headed for the door. Will he?" "I'll do my best," I promised, already mentally preparing for the complex surgery ahead. "Meet us at Metropolitan Memorial." "And Victoria." I smiled slightly. "Sorry about missing the reception." As the ambulance doors closed, I saw my mother's stunned face in the crowd. The daughter they'd hidden in the kitchen was about to attempt a surgery few doctors would dare. Time to show them what this servant could really do. The emergency room doors burst open as we rushed James through. My surgical team was already assembled, Their surprise at my formal wear quickly replaced by professional focus. Type A aortic dissection, I called out, striding toward the OR. Get me my scrubs and prep for emergency surgery. Dr. Chin briefed the family when they arrive. Yes, Chief. My team responded in unison, the well-oiled machine I'd built over years springing into action. As I scrubbed in, I could hear the commotion in the waiting room, my family arriving in their wedding finery, demanding answers, their social status meaningless in these sterile halls. Where's the real chief of surgery? My mother's voice carried through the corridors. I demand to speak with whoever's in charge. Dr. Chen's calm reply. Ma'am, Dr. Mitchell is the chief of surgery. She's the best cardiothoracic surgeon on the East Coast. That's impossible. She was serving champagne an hour ago. I finished scrubbing, letting their voices fade as I entered my domain. Here in operating room 1, nothing mattered except skill and precision. No family names, no social status, just the intricate dance between life and death. Patient's pressure dropping, a nurse announced as I took my position at the table. Beginning median sternotomy, I said, my voice clear and confident. Let's save my sister's wedding day, shall we? The next 6 hours were a masterclass in surgical expertise. Every cut, every suture, every decision made with the precision that had earned me my position. My team moved in perfect synchronization, anticipating my needs before I voiced them. BP stabilizing. Excellent repair, Chief. Look at that anastomosis. Textbook perfect. Through the observation window, I caught glimpses of my family. My sister still in her wedding dress, my mother clutching her pearls, their faces pressed against the glass as they watched the servant perform microsurgical miracles. Dr. Mitchell, one of the residents whispered as I completed the final suture, they're calling it your best work yet. I smiled behind my surgical mask. Let's close him up. Families waited long enough. In the scrub room afterward, I took a moment to collect myself. Through the window, I could see my mother pacing, my sister sitting pristinely in her now wrinkled wedding gown. Dr. Chin appeared at my side. They've been asking questions. About your career, your achievements. I may have mentioned the Carter Award and the surgical technique named after you. The Mitchell procedure, I nodded. Funny how they never wanted to hear about it at family dinners. I changed into fresh scrubs and stepped into the waiting room. My sister leaped up, her mascara streaked with tears. Eleanor. Is he? The surgery was successful, I said professionally. The aortic dissection was severe, but we managed to repair it. He'll need several weeks of recovery, but he should make a full return to normal activities. You. My mother started, then stopped, staring at the hospital staff who nodded respectfully as they passed. Chief, the board chairman called. My assistant approached. He wants to discuss featuring the Mitchell procedure in the National Surgical Conference next month. Schedule it for Monday, I replied. And push my morning surgeries tomorrow. I'll want to monitor James's recovery personally. Of course, Chief. My sister sank into a chair. All those times you tried to tell us about your work. And you said I was wasting my time? I finished gently. That I should focus on finding a husband instead of playing doctor? But my mother gestured helplessly at the bustling hospital around us, at the staff who deferred to my every word, at the plaques on the wall bearing my name. The youngest chief of surgery in the hospital's history? I supplied. The developer of a revolutionary cardiac procedure? The doctor who just saved your son-in-law's life. A nurse hurried up with charts for me to sign. Dr. Mitchell, your patient from last week. The diplomat's daughter? She's being discharged tomorrow. Her father asked to personally thank you for saving her life. I signed the forms, aware of my family watching this glimpse into my real world. Schedule a follow-up for next week. And please have someone bring Mrs. Wellington a change of clothes. That wedding dress can't be comfortable. Right away, Chief. My sister touched her ruined gown. The reception. Can wait, I said firmly. Your husband just had major surgery. There are more important things than parties. Like saving lives? She asked quietly. Exactly. I checked my watch. I need to check on James. The nurses can show you to the private waiting room, much more comfortable than these chairs. As I turned to leave, my mother caught my arm. Eleanor, when you tried to tell us about becoming chief of surgery, you said I was embarrassing the family, I remembered. That no daughter of yours would work in a common profession. Around us, the hospital hummed with life, monitors beeping, staff rushing past, the endless rhythm of healing and hope. I should check on my patient, I said professionally. The help has work to do. I walked away, leaving them to absorb the reality of who their embarrassment had become. In a few hours I'd saved not just a life, but perhaps their understanding of what really matters. The next morning I made my rounds in crisp professional attire, a stark contrast to yesterday's borrowed servant's uniform. James was recovering well, his vital signs strong, the Mitchell procedure proving its worth once again. Outside his private room my family waited, still in their wedding clothes, looking out of place among the medical equipment and bustling staff. Morning rounds, I announced, entering with my team of residents trailing behind. How's our patient feeling? Like I got hit by a truck, James managed weakly. But alive thanks to you. I checked his incision site vitals and medication levels, dictating notes while my residents absorbed every detail. This was teaching time, another part of my role they'd never bothered to understand. The repair is holding beautifully, I told them. Note the superior placement of the grafts, minimal tissue trauma. Dr. Mitchell, a nurse interrupted. The CDC is on line 1. They want to discuss implementing your procedure as the new standard protocol. My mother's eyes widened. The CDC? Her embarrassing daughter was setting national medical standards? Schedule a conference call for this afternoon, I replied. And please bring Mrs. Wellington the clothes we had sent up. Victoria, still in her wedding gown, looked lost among the medical terminology and professional respect flowing around me. This was my world. Precise, purposeful, powerful in ways their social circles couldn't comprehend. Chief, one of my residents stepped forward. Should we present this case at next week's surgical conference? The emergency adaptation of the Mitchell procedure could advance the field significantly. Prepare the case study, I nodded. Focus on the rapid intervention protocols we developed. The Mitchell procedure, my mother repeated softly. They named it after you? Along with the Mitchell cardiac protocol and the Mitchell-Chin approach to emergency thoracic surgery, Dr. Chin added, entering with more charts. Your daughter has revolutionized several aspects of cardiac surgery. I continued my examination, aware of my family watching this glimpse into my real life, where I wasn't the disappointing daughter, but a pioneering surgeon who saved lives daily. Eleanor, Victoria said suddenly, all those times you missed family events. I was here, I finished, checking James's cardiac readings. In surgery, developing procedures, teaching residents, running one of the country's top surgical departments. But yesterday, my mother started, at the wedding. You needed serving staff, I said calmly, updating the treatment plan. So I played my assigned role. Then I saved your son-in-law's life using techniques I developed. Interesting how life works out, isn't it? A commotion outside drew our attention. A group of suits was approaching, led by the hospital administrator. Dr. Mitchell, he beamed, entering the room. The board just approved your proposal for the new cardiac center. Full funding, complete autonomy. They want to name it after you. My mother gripped her designer purse tighter. A hospital wing named for her embarrassing daughter? The Mitchell Center for Cardiac Innovation, the administrator continued. Your revolutionary procedures deserve a dedicated facility. Thank you, I said professionally. Please tell the board I'll review the plans this week. After they left, silence fell. My family stared at me like they were seeing a stranger, perhaps finally seeing me clearly for the first time. I should check on my other patients, I said, gathering my charts. Victoria, there's a shower in James's private bathroom if you'd like to freshen up. Mom, the cafeteria actually serves excellent coffee. Better than champagne in my opinion. Eleanor, my sister called as I reached the door. The wedding reception. We could reschedule it. Maybe when James is better. And maybe, she hesitated, you could attend as yourself this time? Not as staff. I turned back, seeing something new in her eyes. Respect, perhaps even understanding. I'll check my surgery schedule, I replied. Speaking of which. My phone buzzed with a familiar urgent tone. Somewhere in this hospital, another life hung in the balance. Duty calls, I said, already moving toward my next patient. The help never really stops working. As I strode down the corridor, my white coat flowing behind me, I heard my mother ask a nurse, "Is she always like this?" "Oh, in command. Dr. Mitchell," the nurse replied. "She's the best we've ever had. Saved more lives than anyone can count. We're lucky to have her." I smiled slightly as I entered the OR for my next surgery. Let them watch, let them learn. The daughter they'd hidden in the kitchen had built something more meaningful than any society wedding. My surgical team stood ready, instruments gleaming under bright lights. Here in this sterile sanctuary, nothing mattered except skill and dedication. No family names, no social status, just the sacred duty to preserve life. "Scalpel," I called out, my voice clear and confident. Another day, another surgery, another chance to prove that sometimes the best revenge isn't proving them wrong. It's saving lives, including those who doubted you. And if someone needed me to serve champagne again, well, I'd do it with a smile, knowing that under the borrowed apron beat the heart of a surgeon who'd changed modern medicine.